Okay, we have our panel. We have our Mohalim. I'd like to welcome the Mohalim. If you noticed, the group of Mohalim are from all over the world. Some are from Russia, Israel, France, and locally we have Mohalim from Williamsburg, Kiryas Yoel, Lakewood, Muncie, and all over the area. So, Borough Park. The esteemed Mohalim from Borough Park. So I would like to start off by saying that this year is a little informal in the fact that we're more of a discussion, more of a question and answer. I told the panel to be ready for any question that comes their way. I understand that Mohalim should not be afraid to ask questions. That's part of what we do. I want to give thanks to Yochanan Klein. He's not here now. He's a Mohalim from Miami. He runs the organization Healing Hearts of Bikur Cholim, the International Bris Association, those that put effort to get everyone together here. And there are those that are going to be watching this as it's being recorded. The panel consists of our esteemed urologist, a pediatrician, anesthesiologist, and a rabbi. The rabbi I mentioned last because the rabbi has the last word when it comes to halacha in how to actually implement the bris, the timing of the bris. I'm going to ask the panel, each one, to say a couple of words as an opening, but I'm going to ask the Mohalim to please interact, ask questions, and the discussion. The first individual that's going to be in the panel, and we've known him from before, Dr. Jeffrey Stock. He's Chief Pediatric Urologist of Mount Sinai Children's Hospital. To all of us, he's known as a friend, as a support, as one who makes himself available to Mohalim worldwide with questions and sometimes contradicting local doctors and assisting Mohalim whenever possible. He makes himself available. I don't think he's afraid to give out his phone, his cell number. That's what he does. And we're here to utilize his expertise and his friendship and his support. We have Dr. Avram Pollinger, a pediatrician, again, supports Mohalim, answers questions. Mohalim have many times questions to the child's health and condition, and Dr. Pollinger is always available to assist Mohalim whenever needed. The addition this year is Dr. Zev Nelkin. Today, everyone is very sensitive in pain management. Parents want to know, how could you do a bris perhaps with a feather instead of any other way, because they don't want the child to make a peeps. So we figured we're going to bring an anesthesiologist to know what can be done, if anything can be done, and if anything should be done, and what should be avoided. Rabbi Kasimov, he's a renowned, well-known Rav. He's just been appointed the Rav of this Maradasa of this shul, a very known posek, and to all of us, he makes himself available, and we thank him very much for coming here as part of the halacha discussion. I'm going to start with Dr. Stock. Usually we start with others, but this time, again, we're going to discuss the medical points first, and then the doctor and the Rabbonim will have their input. I'm going to ask him to start it by saying some words to begin with, but before that, Poischim Bidvar Malchus. There's a very known kasher. The bris is not only a mitzvah, it's one of the essential mitzvahs. It's also considered the ois. There are three mitzvahs that are given the notion of a ois: Shabbos, Milah, and Tefillin. The acronym for the word Shabbos is Shabbos, Bris, and Tefillin. We always have two of the oisies, whether it's Shabbos and Bris, or Bris and Tefillin. We always have two oisies. Bris on Shabbos is not permissible to considered a contradiction to Shabbos, but actually doing a bris on Shabbos adds kedusha to Shabbos, because Shabbos, as known and is considered the ultimate in the cycle of nature. Bris is 8 beyond the cycle of 7, which Shabbos represents. Doing a bris on Shabbos is not just a desecration or mutter to desecrate Shabbos for a mitzvah, but rather it infuses kedusha into Shabbos. I'm saying this because I feel at this point all Mohalim appreciate Dr. Stock's work. All Mohalim appreciate his dedication, his self-sacrifice. I want to present him with something that will add kedusha to Shabbos, and it represents a bris as well. So. With that, I'm going to give you the microphone. No, you can sit, Unless you want to stand. However you want.
Rishus, distinguished rabbis, Mohalim. So, most people take for granted, families, that, when they have a baby, that they're going to have the bris on time. And most of the time, I'm able to help, probably 95, probably to 98% of the time, and say, these babies can go ahead and have the bris on time. But there are occasions when we have to wait, and it's a real struggle for the families. It's very difficult, and we all assume that the bris is going to happen, if not on the 8th day, if the baby has a bilirubin a few days later. But most of us in the room have some babies, if they've worked within families, that have to wait. We had a family too recently, both had hypoplastic left hearts, severe congenital heart disease, and we had to wait till they were 3 years old. And as big as a simcha is on the 8th day, you can sort of imagine what it's like for these families when they have to wait 3 years. So I think it's important that we don't take that for granted. I try to be available because I've learned to understand the pain these families have when they have to wait, and we try our best. But just today I had to tell a young couple that they would have to wait. But it's interesting, this network that's in this room and how far it reaches. Earlier this week I saw a baby that wasn't Jewish that had hypospadias. The mother was very nervous. She'd been on the internet. She read about all these complications. And she said, I was a nervous wreck until I went onto this Facebook page. And somebody from Africa wrote and told me, don't worry, if you're going to Dr. Stock, you'll be fine. So I said to her, Africa, were they from Zambia? And she goes, yeah. How did you know that? Because there was a Chabad family in Zambia that I took care of. So the network's amazing. So I'm glad to, answer any questions and help. I'm interested to hear what everyone has to say. I'm sure I could learn some things from this group, probably more than I could teach.
Did you want a laptop connection to this?
No, let's
Okay, I'm going to ask Dr. Avram Pollinger to give us a little bit of his experience, communication with parents, pre or post or Mohalim that have questions. And then once we hear from him, we'll go to the anesthesiologist, but then we'll have questions from everyone.
Hello, everybody. It's a pleasure to be here. Some of you I spoke to on WhatsApp or phone calls about babies from all over the world. I happen to work in a small little village called Kinus, where there's a few thousand babies. So the default option is to have your bris on the 8th day. Sometimes we can, sometimes we can't, but we try to make it happen. And for all sorts of medical reasons or other questions. And I'm happy to help anybody if they ever need anything or ever need some advice or some questions. I'm happy to give my input.
When's the last time someone said top in the Jewish?
Ask Levi Heber.
My question is, for the answer?
Sure.
Baby was born in the morning, he has fever, 102. But the mother has fever also. But during the day, after 3 p.m., the fever was gone.
On what date did the baby have fever?
Loud, loud. Don't be afraid, loud.
When the baby was born.
The day that the baby had born had fever?
Yeah, he was born with fever.
I would tell you that the baby is a chayla.
Yeah, I understand, but the one could be start count the 7 days.
It depends on what happens with the baby.
All the tests came back negative, and by 3 p.m. was no fever at all.
Was the baby put on antibiotics?
No, he didn't give anything. They put him oxygen until 3 p.m., but they measured every hours the fever was down. By 12 was 99.8, another hour was 98. But by 3 p.m. the fever was gone, and they took him off oxygen.
And the baby received no other support? Was totally fine?
Yes. So when could you count the 7 days?
I would defer to the Rav.
So he wants to know if it's considered
It's-
a chayla, and then
A baby that's born with fever is clearly a chayla. Okay? The question is, at what point do you say the baby is not a chayla anymore? If they didn't give the baby any medication, they didn't give the baby any support, and within 24 hours the baby was okay, it's not the typical situation, because any baby that is born with fever in most places would be giving antibiotics and would be treated, and they wouldn't just decide at 3 o'clock on that day that the baby is okay. It's a very unusual story. So, a baby that's born with fevers is typically going to get blood tests that will take 2 days for it to come out. They're going to put the baby on antibiotics for 2 days. I'm not sure the exact details of this case here. So it doesn't usually happen. Usually what happens is that there's a problem on the first day. They put the baby on precaution, antibiotics, things like that. After 2 days, they see that the baby is totally fine. And then from when that happens, then you can count and do it. So it's a little bit of an unusual situation.
They held the baby for 2 days. They need to.
Of course they did, but they did nothing but watch the baby.
What do you watch? Maybe the first day they gave antibiotics.
So now with the story, you know what the lesson from this is? Is that very often you have parents who tell you one thing, and then what actually happened is something. You have it all the time. There was nothing ever wrong with the baby, and then you actually look in the chart and you see, okay, so this happened and this happened and this happened and this happened, but people feel a pressure that they have to have the bris on the 8th day, because if they don't have it on the 8th day, it's there's something wrong with the baby. There's something maybe I don't know, and then when you actually look in deeper. And then, they actually did give the baby antibiotics. So if they give the baby antibiotics, that changes the whole story.
So what did the Mohalim have to do?
Speak to the doctor.
Doctor. In order to understand.
I see babies in the hospital, so I know exactly what's going on with these babies. Anytime someone's going to call me from Kirsel from a baby that I didn't see, I ask them, find me the discharge summary. Did you speak to the doctor? Did you find out what's going on? Because with anything, I find out not only with brisim, very often what the parents tell you It's not exactly what happened. They didn't understand. They didn't think it was important. They didn't know exactly what was there. And then when you actually look in, the story changes differently. So that's what I told you. It sounds very strange that baby was born with fever and they didn't do anything, and all of a sudden, 3 o'clock, the baby was okay. It's a very unusual story.
Mean to say that you can't rely on the parents, you have to speak to the doctor.
I think so. Yeah, I mean, if you want to make a decision about whether a baby is ready and there's something that's unusual there, to just unless you have a parents who are very into it and but you know what happens mostly. You have a young family. It's two people. They're 18, 19 years old. It's their first baby. They're not sure what's going on. Everything is like this, and they don't follow what's going on. You have to speak to the doctor. Call into the NICU. Speak to the doctor. Find out what exactly happened, and then you can make a better decision.
Okay, thank you. Let's go ahead.
We're going to ask Dr. Zelvnelkin to give us a little bit of his experience with anesthesiology.
Well, that's a long conversation. I do want to preface this with a couple of things. Number one is, as much as I loved, as a resident, I loved pediatric anesthesia, and I even thought about doing a fellowship in pediatric anesthesia. I don't do pediatric anesthesia. However, there's certain things that just, when it comes to Brisbane in your situations, I think I could probably handle some or all of your questions because it's not specific pediatric anesthesia. We're not dealing with sick babies. Generally. That's number one. Number two is my experience with Brisbane, actually, is with adult urologists, people I work with. Oftentimes, I'm at a urologist and they're doing a circumcision, and I see the patients a yid. So my job is, at least that's how I would think of it. I actually work with other from anesthesiologists, and they don't do the same thing. They weren't brought up the same way I was brought up in a Lubavitcher mishpacha, that you grew up, that you ask another Jew about the Yiddishkeit. And so oftentimes, if they have a Jewish name, you have to first of all make sure that they're actually Jewish and it's not from their father. It's also from their mother. But once I know that they're Jewish, I say to them, listen, you're having a circumcision anyway, let's do this. And Baruch Hashem, I work mainly with Yiddish, not necessarily from, but Yiddish urologists. Most of them are from too. Most of them are from modern Orthodox or even more. So I have the ability to create a situation where we actually make a bris and we don't just do a circumcision. My last one that I did was actually 2 years ago, mamish around this time, because it was right after the whole situation in Israel, right after October 7th, but not immediately thereafter, but it was around this time of the year. I'm just going to tell a story just to give you guys a bit of a nice story. So this urologist, it was a Friday, and Friday usually was not in this urologist's office. What happened to the schedule, I have no clue, but they put me there. And they put me there, Pashut, the Eibishter was Mesabif Sibuvin. There was a Russian Jew who came in his 80s for a circumcision. Generally at that age, they really don't need it. The younger men in their 20s, 30s, 40s, they might need it for phimosis. But by 87, they're not worried about that anymore. So why is he coming? So first I saw his name, his Yiddish name. I asked him if he's Jewish. He said for sure. And we spoke in Yiddish a little bit, which is also key. A lot of the shluchim will tell you, if you get a Russian dude and he's in his 60s, 70s, or 80s, and he does know a word of Yiddish, not even one word, then you have to start questioning his Yiddishkeit. But if you do know his Yiddish, if they do speak Yiddish, you don't have to question the Yiddishkeit. Anyhow, so I asked him what's he's doing there for circumcision. Let's do a bris. So he says to me, that's what I came for. I said, what do you mean? So it turns out his two sons had their brisim. I don't know exactly what the situation with their brisim was, because from the story it was difficult to really chop if they got a proper bris or not. But anyway, they had their brisim. Now, because of October 7th, he decided that because they did this because they were Yidden, he says there's no way that he's going to die without being a full Jew, and he wants to have a circumcision. He thought circumcision, you find a doctor, Baruch Hashem, he got it from doctor, that you should do the circumcision. So I said, oh, so you want to have a bris? He said, yeah. So I said, no, right away I called Levi. Whenever I get these situations, I call Levi. So exactly what do I need to do? Fine. So Levi told me whatever it is. So then I said to him, do you want anesthesia? He says, I have to be awake for my bris. So he was awake for his bris at 80-something years old. And we gave him a name. We did the bracha, we gave him a name, Avasandek. And his name was Moshe Ben Aaron. He chose the name Moshe and his father's name was Aaron. So Moshe Ben Aaron. I'll never forget that name. And that's a story. So my interaction with bris and anesthesia is very little in terms of that sense. But I'm open to discuss the topic itself and stuff like that. If there's any questions, I'm here to answer.
There will be questions, and I'm going to ask the Rav to give a little opening.
I do want to say one thing about this. I'm going to say because I understand I'll probably get some questions, and like I said, I will defer to the Rav because I not necessarily is anesthesia a good thing at by bris, and we have to let the Rav talk about that.
Okay, Yeshua Kayach, Rabbi Heber, Shos all the Mishtatvim. So, Dr. Nelkin mentioned a very important nukuda. I don't think that was what he was really going for, but once he already mentioned it, I think it's very important to discuss the union of Bira Yados and Bechlal, to stand strong and not to allow any appearances. Many, many times, you're getting calls Me'ari Asada from people in the middle of nowhere, and they're making demands which are not according to the Messiah of how Brisim were done. And the question is, the Mohalim are put under serious pressure. Do I give in? Do I not give in? No one's going to see it. Right? Okay, whatever, I'll just do it. So it's very, very important, extremely important. The first thing that you have to remember is your Shlich of the Eibishter. The Eibishter gave the Kaich, the Schus, to be Mezaka Yidden with the Eis Bris Kodesh. This is not a joke, this is a tremendous Schus, a tremendous Schus. You're bringing Yidden into the Bris of Avram Avinu. This is tremendous. You have to thank the Eibishter for such a Schus every single day. And it's very, very important that the mitzvahs are done kitikunam. You have to continue going in the proper way that your teacher taught you, not to be nispal from new things which are coming out, new ischakmos, this, that, different shortcuts. You're taking a leniency here, you're taking a leniency there. And Havaya Imay, the Eibush is going to be with you. And I want to tell you a story, but did you have a uvda? I'm not a male, but I received the shaila. I said the story publicly a few times, but it's a very important story to hear. There's a shlich in the middle of nowhere, in the middle of maybe Virginia. I don't remember now. I remember who it was. I forgot where he is. Okay, doesn't make a difference. Mamish in the middle of nowhere. So this is not Mamish a Shaila of a bris. The Shaila was a little bit different. The Shaila was as follows: so that they were going to get a doctor, a not-from doctor, to come to do the bris. And they invited him as the Rav of the Kehillah to be mishtatif. He should come together, a communal event. V'chulu, they're doing it in their house. Obviously, the doctor's a Mechalel Shabbos. Obviously, he was not going to do bris k'halacha. He was going to use machshirim, which we do not use, which are things which we should not be using. And there was a lot of pressure because he was a big donor. They gave a lot of money. And the pressure was on. The pressure was on. If he's not going to come, it's making a huge statement. It can shake up the entire Kehillah. You didn't go to the big Menadev's Bris, Hayitachin, V'chulu, and they can start Churbanis, they can start big Machleks and Rachman al-Islam. So he called and he's asked, what should he do? So obviously the answer is you don't go. Davar Pashat, you don't go, you can't go. You're the Rav in the Kehillah. It doesn't make a difference if you know Yeridei, you don't know Yeridei. In the eyes of your community, who don't even know Aleph Beis, you're the Rav, you're the Mother, the Asra of this place. And this is your responsibility. By you going, you're giving a stempel that this is an okay practice. So he had a very hard time being Makabel. Very, very hard time. And he told me after, we spoke a few weeks after, I didn't hear what happened, I didn't hear the whole story. I don't know what happened. I told him, you have to stand strong. You're not allowed to do such a thing. If you're going to do it, you're going to create a korban in the entire Kehillah. This is going to become okay. They're going to tell their friends about it. This is such a nice doctor. Come, 1, 2, 3, he does whatever you want. And they're going to tell their friends, you mevatel the mitzvah of milah. It's a terrible thing. So a few weeks later, we were speaking. He called something else, and he told me the whole story. He told me, be'emes, it was very hard for me to be makabel. Very, very difficult. But I realized, what am I doing here? I'm here for my own personal gain. I'm here to make a few more dollars from him. No. Khalil, I'm here to bring, to spread Yiddishkeit, authentic Yiddishkeit. I'm not here to cut corners. I'm not, so he went, he didn't go. He went, meaning to say, bedaite, that he was machlet, I'm not going. The family is obviously, they're not foolish people. They realize good and well why the rabbi is not coming. And that's it. They took the message. Some time passed. The mother felt very, very bad. I guess she had more of a hergish, whatever. And she wanted to be Masak in the Indian, so she called him to ask what could they do. She felt very, very bad. The father, I don't think the father cared. He was a Yid, but whatever. He couldn't care less. He was upset at the rabbi, don't get me wrong. He was very upset. But he couldn't care less about being Masak in the bris. So the Teitzah is what happened, where first of all, he was afraid there's going to be a whole machlekes in Kehillah, Hayitachan, you didn't go to this person's bris. Nothing happened. What happened was, Adrabah, the community realized he did not go to the bris. And they chapped why he didn't go to the bris, because they were not using a male, they were using a doctor who's a Mechal Shabbos, and he's not doing a Kalacha. And because of that, there were two people in the Kehillah who were expecting at the time, and they saw what happened, and they right away called months in advance this rabbi, this Rav of the Kehillah. What can we do to make sure that it's kosher? What can we do that it's okay in the Kehillah, and that you're going to be mishtatif? And because of that, as far as I know, 2 mishpachas, and obviously it's going to be more, we're Baruch Hashem zeicha to do bris properly. But there's even a bigger punchline. This is a davar tafel, but we have to know that das balabatim is hepech das Torah. He was thinking, he was so afraid he's going to lose out many of the davas, he was going to lose out a lot of money. What happened in the end was he was making a campaign, a fundraiser for the shul. And he didn't have, there's no way he was going to send them a message to ask to be mishtatif after what happened. Even though, technically Baruch Hashem was a happy ending, 2 other families were okay with it, but he didn't have the ha'azah to send them a message. They found out about it by themselves. I guess from other people in the Kehillah, they spread the word, and they sent him on a dava he couldn't imagine, because they respected him. They said, "You're a real rabbi. That's you're a real rav, and you have values that you stand for." So we can think, you're going in the middle of nowhere. Cut corners over here, cut corners over there. That's not so bad. I'm not in town. I'm out of town. Whatever. They're not from anyways. Who cares? Whatever. The answer is no. The Eibusha gave the mitzvahs. They're Yidden, and if you're being kind, the mitzvah has to be kitikona. And I want to tell you furthermore. I was speaking with Dr. Nelkin and Rabbi Heber as well. Whatever happens mibachutz can also creep in Rachman al-Islam bifnim. All these improper days, whatever machshavs the people are thinking, any chalishas in the mitzvah, it creeps into in-town communities as well. And if you're strong mibachutz, you're going to be mechazik mibifnim. You have to be very, very strong. You're on the front line. You're traveling. You are the front line. You are holding Yiddishkeit to the strongest point. If you're strong outside, it's mechazik mibifnim as well. So it's very, very important. We have to be mechazik ourselves. We have to remind ourselves we're doing melachas Hashem. We're not doing anything for ourselves. And if you think you're doing for yourselves, maybe you should reconsider. If you're doing it for parnasa, if you're doing it for COVID, maybe the person should take a different job, go into business. This is not melachas HaKedesh. It's not melachas Hashem. If a person is kal in yados and bira yados, you're not really checking, whatever. They're giving you the paycheck. Okay, it's good. It's Jewish. You look Jewish. Oh, Jewish lands. Oh, very good. Chalila, get a new job. This is not for you. You have to realize that you are a shlich of the Eibishter. Okay.
Yeshkayach. I want to take again this opportunity to acknowledge the diverse community of representation of Mohalim from all over the world and from all over different communities. Shevasachim, a bris is done at a young age. It's the most essential mitzvah. I've had this incident where it seems like she was, let's just say, reform. Rabbi, I'm reform. I want you to do a reform bris. So I don't know what she's talking about. I've never heard of a reform bris. I thought maybe she wants, I don't know. So I said, you know what? What's a reform bris? So she says she doesn't know, but I'm reform. I explained to her that your child is just as Jewish as every other child. There's no reform at that age. There's no conservative at that age. There's no orthodox at that age. Every Jewish child deserves a bris for thousands of years. It's been done the same way, and I'll do upon your child the same way that every Jewish child gets. So we reach different backgrounds, we reach different communities, and we have to understand that everyone has their way of viewing, but the essential mitzvah of bris is what we represent, which is very important for us to have the panel. I'm going to ask Dr. Stock a couple of questions, but I want him to say a little bit about his experience, and I'm asking the Olam to please communicate with him. There's two microphones. We're here for that reason.
So just along the lines that you were speaking, there was a major donor to the hospital. When I say major, tens of millions of dollars. And the hospital calls me up. The president of the hospital says, they had a grandchild. They want you to do the bris. So I meet the parents. They're obviously Jewish. I said, you know what? You don't really want me. You want a moho. No, we want you. I said, listen, I'm going to get you a moho who's top-notch. You'll be very happy. Well, we only agree if you come. So I took off the morning. I went. It was on Park Avenue. Someone who's in this room came, did the bris, and they invited them back when they had another grandchild. So I do some meal, but usually it's on Shabbos in my community to give you guys a break. But I think it's important that it's not for the doctors to do. But there are occasions when you talked about an 80-plus-year-old man. The sadder stories are the people who have babies, and I'm seeing a lot of Israelis. This couple came in with a baby that was 2 weeks old, and they wanted a circumcision. They came to the office, and the baby's first name is Enzo. So maybe they're Italian. I said, Enzo, that's an interesting name. Where are you from? Oh, we're from Israel. I said, you're from Israel. You want your son to have a bris? All right. So, I mean, it's such an afterthought. And I've been seeing more kids for other things, other conditions they're Israelis, and you open up the diaper to examine them, no bris done. I mean, this didn't happen a generation ago. So it's kind of sad.
I'm going to ask you some questions, and I'm going to want those who have experience with situations to chime in as well. So the question that was presented by many before, certain questions they asked me to prepare, and I'm going to, I know that hypospadias is something very common, and it's been discussed many times. The question that was represented was, at what point is there absolutely the male should not touch it and say, hey, I'm not going to do the bris because I see there's a condition. And if you could describe a little bit when it can be done, if there's any points that you would recommend the male do it in a way that will help the surgeon.
Right. So, if you look in the textbooks, they still say, if you have hypospadias or core D or torsion or any really anomaly, you should not do a circumcision. That's what the books say. That's the training. That's why, around the world, you'll find a lot of urologists who say absolutely not, don't do it. The reality is that you can do a bris, you can do a kosher bris. So one criteria is obviously if I'm going to say yes, I'm having a conversation with them all, and I'm saying this is what I need to do the repair. Can you do a kosher bris? Because if you can't do a kosher bris, there's nothing to talk about. So in general, the vast majority of the hypospadias are distal. They're on the glands or right below. And the deal breaker is whether there's core D. So if you've got significant, because most of the repairs we do now, you don't really need the orla to do the repair. If you've got core D, that's another story. You're just short of tissue on the underside at 6 o'clock.
At that point,
and
they
you
do need some extra
Right.
skin.
So again, it depends. It's a judgment call. You need to see the baby. You need to see how much pria there is, how much of a bend there is. I mean, we can show some pictures after, but
I can give everyone my secret. I tell the parents, I give them Dr. Stock's text, tell them, ask if they can communicate, send them a picture, and usually the response is pretty quick. And usually the response is it's okay to do it. And so I just
right.
want everyone to know that there is that backup opportunity. I'm going to ask you another question because today somebody texted hematoma. They did the bris. Afterwards, there's this black bubble. It seems that the bris itself has healed, but that is still in. What should they do? And if you can give us some insight to that.
How far out is this? Is this like the same day?
3
or-
days after, 2 days after.
I mean, if it's not expanding,
It's not expanding.
then you probably could just leave it alone.
And then it'll dissolve by
Right,
itself.
right.
Right.
I mean, the parents just need to be reassured that, just wait it out.
Another question, webbed penis.
One second, on the hematoma, is there an advantage in actively forcing it and squeezing it out?
I mean, it depends how far out it is, how
You notice
well.
at the bris itself.
No,
you
at the
can
bris,
see
it's
the-
another story, yeah. So if it's
You see it growing just.
if it's fresh, you could squeeze it out, and maybe you could.
And if
You
it's
can
hard
see.
a week later, like a little pebble,
Yeah, no, I would just leave it alone.
let it go out. Is there ever a time where you would say, release it, get it out, cut it out?
Not if it's if it's not actively bleeding, it's
Inside,
sort of
just
contained.
a little dry
Yeah,
spot.
just I would leave.
Just leave it. Webbed penis is quite often.
Right.
Sometimes it's severe.
Right. So there's a gray area between let's say called webbing between penoscrotal webbing and core D. Right. So if you can have webbing where you just have less skin on the 6 o'clock side, or just what we call skin core D. So if you free up the skin, let's say in the OR, if we free up the skin, you peel it all down, it straightens out. Or you could have, it's more severe, the other end of the spectrum is core D, where the corpora, the tissue underneath, it's uneven. So that's not going to get fixed by a bris. So most of the webbing, if you cut on a severe angle, it'll make up for it, it'll release it.
It's important to note that if you don't cut on a severe angle, you're in trouble.
Right, because if you come across even, and the issue for non-Jews in the hospital with Gomkos, the tools are made to make an even cut, and you're going to take off all that
Scrotum.
skin and you end up on the scrotum. Yeah.
I have a question for me. Thank you. Miosis Rugo from Miami. Just if we see that the bris is really so miraculous, the way it heals and everything, why is it that many urologists insist so much in do it with stitching and anesthesia, and it takes 20 minutes at the hospital, and I have no babies, and they tie him up, and they this whole like scary thing that it really looks very saying you see any moil that does it in 40 seconds, a minute, and then they go to the other extreme of like making something that looks so unattractive. Why is it like even like certain moils that are like more, let's say, reform, that they do it more from the medical So you will see that they do with other tools that are much more, you know, eye-catching, like traumatic than.
So I think some of it's a skill set. You know, I have the advantage. Anyone who's, you know, been in my OR, you know, I can put the table up to the exact height. I've got lights. I have assistants. You know, you're out in the trenches. You know, you're in a dark room. You have a low chair. You've got a Sandik who's 95 years old. You know, I mean, so yeah. So if you know, if you're formal, so he's gonna say, I'm not going to do all this stuff. You know, they don't have the skill set. So I think that's the difference. So.
Before we go to the doctor, I just want to ask you one more question that's been asked repeatedly. Adhesion. Coronal adhesion.
Yes, that's a good question. So also there's a spectrum there. You can have a little flimsy adhesion, which will separate. You give a little tug, or you can have a skin bridge. And you know, like once, twice a year, I will see a from kid who's 10 years old who has a skin bridge that somehow never got picked up. And I mean that you have to cut sharply. You can't just peel it apart. So that, you know, I think we can talk to Dr. Pollinger about it in terms of, you know, because you're seeing the babies at a month, at 2 months, at 3 months. You know, how many of them have adhesions versus a skin bridge? And do you pull it back? Do you leave it alone? Do you tell them to go back to the Moel?
So adhesions are very common. I used to be very aggressive about opening them and separating them, but actually, with time, I think most of them are going to open with themselves as the penis grows, and it's much less traumatic for everybody to just kind of leave them and watch them. I think I've seen maybe one time a true skin bridge that needed to really be open, but most of the time, as the penis grows, the adhesions will open up by themselves, and you don't have that problem.
Right,
Chubby babies are a big problem. The good thing about chubby babies is they need to be cleaned. So bath time is a great time for mothers to do their own retraction, and most of the time they just naturally are separating the adhesions.
I find something very interesting that there are a lot of pediatricians that at 8 months, 10 months, babies gain weight like anything, and they'll tell the patient that the moral didn't cut enough. It's so basic that a chubby baby with all that fat pad, if you retract,
For sure.
retract, everything is perfect, and they'll say to the parents the moral didn't cut enough, and they're so ignorant. It's unbelievable.
I can't speak for everybody.
I'll say that
I'll tell you what's common.
Latachila, I show them the bris, and I say, you're my witness that everything is off. You should expect that fat pads are going to push it up. It's going to look like it's not, but this, and I don't know.
They'll remember the day of the bris and the trauma. They'll remember what's going to be in 10 months from now.
Yeah.
See, I told you.
I do have people ask me all the time about the fat pad and chubby babies, but I think, you know, 10 years ago I was much more aggressive with these. I think now I'm very happy to just watch them, and 99% of the time they naturally will grow. If you catch something that's a little bit, looks like it's a little bit thicker, if you put on some steroid, a powerful steroid cream for 5 or 7 days, usually that can lyse the adhesion and they don't wind up needing a procedure.
Is it worse to actually break it and then it'll seal again and break it, or just?
Yeah. So if the kid's really chubby, sometimes I'll say, you know, we're going to break it once, and give them instructions, detailed instructions. And if they keep coming back and it's sticking, I say, you know what, we're leaving it alone. When the kid's 3 years old, if it's still there, we'll take care of it. Because either they're not doing what I'm telling them, or they're afraid to do it, and it's not worth repeating over and over. But there are rare occasions where that it sinks into the fat pad, and they get a circular scar, and it gets trapped in there. So you don't want to end up with that.
The stenosis is
Like it just comes together over it.
and it stays
It's
there.
stuck. Yeah.
But standard, instructions should be to just pop it out. Just
Right.
say he's going to get fat, pop him out. Make sure you keep popping it out, and it will never get stuck like that. In that way, right?
Right.
some questions to the doctor, and then we're going to ask the Rav to give the halachic insight to some of those questions. As asked before, child was born and he was put on oxygen. When do we consider him a chayla? In other words, medically, when is he considered a chayla? And then the rabbi will give his insight to that.
So I actually just had a question yesterday from a mother who called me whose baby was born totally fine. Needed a little bit of oxygen right when the baby was born, but the baby was totally fine. And the baby was totally fine and everything was normal. And I told them that I wouldn't consider that baby a chayla. That's a normal part of birth to need something. But if a baby was put on oxygen for a longer period of time than whatever is defined as normal, acceptable, 1 hour, or whatever that is, I would say that that baby is then a chayla, and we'll let the Rav decide.
Could you tell us what's acceptable? Oxygen for how long is normal?
So, l'chadchila, oxygen at all is not normal. Okay? I mean, but delivery is an extremely dramatic and traumatic process, and there are some babies who just need a little bit of time to adjust, and then they're totally fine by themselves. So, if you're in a hospital that is very well equipped, and they're happy to just watch the baby, and there's no drama, and the baby goes to the regular nursery, and everything is totally fine, I would say that's part of the normal delivery process, and I wouldn't necessarily call that a baby a chayla. If there's any time that the baby needs a higher level of care, they're being brought to a NICU, they're doing more sort of procedure, that I think changes the category.
The amount of time that they're in the hospital change? In other words, they go home in 2 days. Let's say they're not a chayla. If they, let's say, keep them 4 or 5 days, that automatically.
If things are being done for precaution, a baby is born and they were breathing a little bit fast, but everyone looked okay, and the doctor decided they're going to do x-rays and start on antibiotics, but nobody ever found anything. Everything was totally fine, and the baby didn't need any support. It was done as a precaution. I would say that baby is not a chayla. If the baby actually needed something in the first 2 days, which makes it almost unlikely that if they needed something seriously that wasn't precautionary, they would leave after 2 days, that would take the baby out of and make the baby a chayla.
Blood
So
sugar.
it depends on the case.
Pressure?
If you have a baby who has a low blood sugar and they're able to give now oral glucose gel and the baby is totally fine, the blood sugars are okay, I wouldn't say that's a chayla. That's a normal part of transitioning to life. If you have a baby who can't maintain their blood sugar and has to be put on IV sugar and IV dextrose, that's not normal. I will defer to the Rav.
Rabbi Banon, there's a question that when a child takes of antibiotics, when do we wait to count? When he finishes, or in the middle, or?
So it depends. If the baby has still fever, when you stop having fever, so it shows that the antibiotics are working, and he needs a few more days just to get better. So then we start from the day he stopped having fever.
So even if it's 10 days of antibiotics, we don't count before the end of the 10 days?
Yeah.
When we talk about a baby on oxygen, is there a difference between
At what point do you wait till
room
after
air
an
type of
antibiotics
oxygen that they have? Is there a chiluk between different types of oxygen that they do with different levels?
Infection is completely out.
But he's still weak, he's still foolish.
It depends on
But while the baby takes antibiotics, he may have a din chulish after because he's getting weak, isn't it?
So it depends. Again, it depends how kind of antibiotics he took, for how long. It depends. It's very hard to be magdir exactly. Each baby it's okay by
So
itself.
according to the rule, basically, when the fever is gone, you can start counting.
If the baby is fine, you see that he is reacting fine, he's eating fine, he's reacting, he's not halosh, it's okay. So but they still want to give antibiotics just to prevent, to make sure.
Correct, but
That's the
unless the
difference.
doctors, why do you take antibiotics? Is the baby is a cholish or not? Cholish. Is he weak?
Lavdafka.
Getting a weakness?
Lavdafka. I mean, the general approach to dealing with babies is to give medicine and ask questions afterwards. So you have very often that babies are getting antibiotics when, if you look backwards, you see that there was nothing wrong with the baby and they didn't really need to do it. But because they're so fragile and because things can change so dramatically, so quick, so the reflex is give antibiotics because then everybody is safe. But so if it's done for that, lav dafka, the baby is cholish or the baby is even a choila.
The antibiotic itself makes the baby weak.
Am I allowed to disagree? Okay. I don't think that giving antibiotics makes the baby a cholish.
Okay, you had a question?
There are different, I hear very, very openly that there's, sometimes I'm told the baby wasn't on regular oxygen, it was just room air. What is this room air type of oxygen, and does it make a difference in terms of the baby being a chayla because he was on oxygen?
So there's two things that are given with oxygen. There's the amount of oxygen, and then there's pressure that you're giving. So it could be that they're not giving any extra pressure, and they're just giving the baby extra oxygen. But room air and oxygen are not the same thing. So room air is 21% oxygen. Everyone's breathing it. You don't have to give anything special. If they're giving oxygen, but maybe they're not giving extra pressure, that's what someone might call room air oxygen. But they don't really go together. It's either you're getting supplemental oxygen or you're getting room air, which has the oxygen in it.
Okay, there's another question which was asked. A child has a sniffle, a cold, some runny nose. Is that something that's considered a chayla? Yeah.
I think it's very important to take into account the bigger picture. So if you have a baby who has a little bit of a sniffle, looks totally fine, eating well, gaining weight well, is strong, everything is good, I don't see the problem. If you have a baby who isn't doing any of those things and there's a question about maybe there's something wrong, that changes things entirely. So you have to look at the bigger picture about where the baby is and how the baby is doing.
So if the mother calls you like the night before the bris that the kid has a runny nose and he's okay, he's eating, but he's just a concerned mother, we just tell him it's fine, if that sounds to be the case.
I mean, if the baby is really otherwise fine, but there's just a little bit of congestion in their nose, I wouldn't say that that alone would make the baby a chayla.
Okay. Another question before we go is, this happens quite often, a clogged tear duct or an infection in the eye. How could we know the difference, or is there something that we need to know about that?
Okay, so for those of us who are lucky enough to work in frum communities, it's almost unheard of to see a true infection in the eye by the time you're 8 days. It almost doesn't happen unless the baby is much more sick. They've gotten an infection, a true infection, and they can also have eye involvement. But just an isolated infection in the eye almost doesn't happen these days, and we give prophylactic antibiotics to the eyes to prevent most of the cases that will happen in outside communities. But in general, if the baby is totally fine, looks great, is eating totally fine, and you're able to see the eye, and the inside of the eye itself is completely white, and there's no redness at all, that is most likely a blocked tear duct and not an infection. If the inside of the eye itself doesn't look completely white and normal, then you have to start thinking that there's possibly an infection, or if you're noticing any sort of rash or something that's around the eye, that's also a clue. But if it's just a little bit of discharge from the eye looks a little bit swollen, it's watering, and you can open up the eye, and the inside of the eye looks completely, perfectly white, this is a blocked tear duct. This is a isolated straight red line. This is birth trauma, and this is not right. Do you consider a baby a chayla after a bris?
But he
Oh,
examined
tongue
them.
tie. No, this is not. Not a problem.
Medically, he's not a chayla. The Rabbanim say it's not a problem.
Are you saying it's not relevant now because they give antibiotics after birth?
It doesn't happen. He says that
It doesn't happen because
The most common reason why babies would get eye infections these days is from diseases that are transferred from the mother to the baby, which doesn't usually, hopefully, not happen in from communities. So those of us who are lucky enough to work in from communities won't. Plus, babies are standard to give them prophylactic antibiotic ointments when they're born that should prevent most of the other types of infections.
working mostly with non-food families and having people that are into home birth, that's something which might be more concerning.
Correct.
Thank you.
I mean, I think parents have the right to refuse, but it's a standard practice in the United States to give eye ointment when the baby is born.
okay. Another common question that was posted: blisters and red spots or baby acne. How can a male know which ones are infected, which ones to be concerned, or is there any information for a male on this? Doctor, this is old doctor still. I think it was there all after that.
So, first of all, please send me a picture. That's the easiest way to know. I mean, baby acne will show up with. It typically doesn't show up by the time you're doing a bris if you're doing a bris on the 8th day. So that's typically not something that you're going to see. And if a baby has a small scattered rash but is otherwise perfectly fine, I would assume that that's a normal baby rash. It usually comes in a few different varieties. So if anyone has a question, they're more than happy to send me pictures. Most of the pictures are happening with babies who are developing rashes after the bris, where people are worried about herpes or other types of infections. The best thing to do is to look at a picture, but any rash that involves any sort of fluid-filled blisters in the area of the bris happening around a week after the bris is concerning, and I'm happy to take a look and give my opinion.
Isolated pimples before the bris?
Before the bris, right?
Isolated pimples where?
In that area.
In the area.
Before the bris, is there concern doing the bris, opening them up, or
What do the pimples look like?
white? Yeah, like white.
Yellow heads, yellow pus head?
Are they big? Are they small?
They come in different. Is there any call them about when they're an issue? And
I mean, if they look like real big fluid blisters, that's something that's quite abnormal. If they're small little yellow pimples and they're in the bris and you could just wipe them off, that's pretty normal. But it's quite uncommon to find true fluid pus-filled blisters in a newborn that's otherwise okay, at least at that age.
If it's only white, it doesn't have a round
Pearl.
golden staff.
Before the bris, I don't know what golden staff is, but
I've seen a couple of times these kind of pimples, and it had like a yellow head on it. Baby's taken to the doctor, they considered it a golden staph infection. Baby on antibiotics, highly contagious, even to the mother, so the mother's told to wash hands before feeding and after feeding, all that kind of, haven't heard of that over here. Okay,
No.
something we have in Australia.
welcome to
maybe if we give the eye ointment, maybe that prevents the staph.
Here, doctor.
I have another question, open can over. So someone mentioned, babies born out of the hospital. So, people think that's maybe a good idea. But so babies born out of the hospital are certainly not getting vitamin K. And my understanding is that in Eretz Yisrael, that the Rabbanut has stated that if a baby hasn't gotten vitamin K, the Mohalim should not do a bris. They've taken a hard line on it. So I'm just curious what's your advice to Mohalim, whether
So, in terms of the need for vitamin K, there's two parts to hemolytic disease, hemorrhagic disease of the newborn. The early part is very well prevented with oral vitamin K. So if you have somebody who is squeamish and they don't want to give an injection of vitamin K, or they have a home birth, or they don't give it, convincing them to give oral vitamin K is very effective in preventing what could potentially be any complications during the bris. I think that there's a most of the people who are having births at home are not coming to me before their baby is having a bris. And a lot of these people are not necessarily interested in recommendations on what we have to say about it. I would encourage everybody to at least have the babies get oral vitamin K if they're not going to give.
When? How many days before the bris?
As close to birth as possible.
I mean, I think the oral vitamin K takes quite a long time for it to work. So
Correct, and
it's
it doesn't
not really
prevent
equivalent.
late disease.
I mean, I just think that it's just people are confusing, fear of vaccines with
Correct.
with this vitamin and.
Correct. There's a growing trend now amongst even babies who are born in hospitals to not give vitamin K, and I have a lot of patients who are actually actively refusing. I mean, like with most things, it's a dance. I'm trying to negotiate and trying to get people to accept and meeting halfway.
How strong is the risk of bleeding?
The risk is very small.
What's the proper dosage of the oral?
I'd have to look it up.
You mentioned, I think 2 years ago you spoke about this, and you sounded, what I got from it was you were very much that oral would take care of it. And it wasn't specifically right after birth
If you're
either.
speaking about complications essentially from the bris, then oral will take care of it. Yes.
What's the other risk?
There's a late disease that can happen between 3 and 4 weeks that is not prevented unless you repeat the dose of vitamin K.
From the bris? Would it be related to the bris then?
No, you can have late onset of the disease that will not be prevented by giving an oral dose by
That wouldn't
birth.
have relation to the bris at all. We're talking
No.
about just the fear of the not clotting properly
Correct.
at the bris.
Correct.
They often don't want to give any oral or any vitamin K. Do we follow the Rabbanut? Still do a bris.
That's the rabbi's question.
And we talk about vitamin K because it's a big trend not to give vitamin K, especially for
Can we confidently tell parents that the preservative in vitamin K doesn't have any of the concerns that they have with other vaccines like mercury? No, I'm saying that's the issue that they're concerned about. A lot of times they'll say that it's the preserve. Right, but how does it preserve? How does it keep a shelf life?
Refusing to say that you don't want to give your child antibiotics when they could need it because you don't want to give it to them by a needle.
The question is, what's the risk? 1 in 10,000? Comparing not to give vitamin K, that the bleeding should happen after versus what's the risk, like any kind of vaccine, the vitamin K can give also 1 in 10,000. An adverse effect. Is there a question
Because
just
you
in
give it
general?
by needle, it is not a vaccine.
This
You're giving a medication to the baby. This is not a vaccine. Should not be lumped into this entire controversy about vaccines. It is not a vaccine. Just because you give it as a needle, it's not a vaccine. So we have to steer the conversation away from mixing vaccines with giving vitamin K. So if someone would need to get an injection of an antibiotic, because you give it by a needle, you wouldn't call that a vaccine. You're giving a medication, a treatment that you're giving by a needle. It is not a vaccine. So completely remove this from the entire discussion of vaccines and all of the things that come along with it, because it, it's not a fair comparison. In terms of what preservatives are inside the vitamin K, I honestly do not know.
Some say there's some mercury and other stuff that could. Sorry?
For this, I could interject a little bit. Preservatives and medications. Preservatives and I can't do this. Preservatives and medications, like local anesthetics. If you have a multi-dose vial, any multi-dose medication has preservatives in it. They usually don't have mercury. I can't say they all don't, but they usually don't. There are other preservatives out there aside from just mercury. Why these things are in the vaccines, I'm not sure. That's not my miktsaya, it's not my line of business. I have enough to have in my head, and I've chosen early on that I'm only going to put into my head what I need, and whatever I don't need, I'm going to leave out of it. So I really can't answer that question. However, most of the medications that they have, the preservatives, are not mercury-based.
I can tell you that when you tell a parent that you're risking extra bleeding, they get a little nervous. And you say versus a vitamin drop, which can help. You choose. And most of the time, if you say it properly, you say it with confidence, and you tell them that there's risk.
I am anti-vax myself. I'm a father of 11 children. I'm anti-vax more than you.
Right.
And this is a vitamin.
This is a vitamin, and this prevents extra bleeding. I can tell.
It's a vitamin.
Right.
If I see someone in the office that has a baby that has a hernia, and they tell me, oh, we're going to use, I went to someone, they told me we use vitamins to fix it. Right, they would give the kid vitamin K, but here we're telling them to give vitamin K and they won't. It's not a rational decision, so.
The question is when people come and they say they don't want to give vitamin K.
Right, they don't listen.
Should we take the baby? If the baby is healthy and the person is experienced enough to stop a bleeding in case it happens. So in that case, if we shy up to we should
Okay, I have some questions that were asked.
say we did it for hundreds of years without.
Okay, first of all, this is a question to the Rav, being that the Rabbanut in Israel came out with a strong statement that if the parents don't do K, a male should not do a bris. I understand the Takana in Eretz Yisrael, they're probably going to get parents to do it, and here we risk a lot more than that. We risk they're going to go to a doctor or hospital and not do through a mile. Do we refuse the bris because of that? Or do we say, listen, it's going to bleed a little more, possibly, and we'll take that risk? Rabbi.
Is the risk of bleeding a little more, or a risk that you can't stop the bleeding? Well, it's medical bleeding, right? So it's not surgical. It's surgical. Well, it's medical because the clotting is off, right? You're missing a
Factor.
So it may be a little harder to control than if it's just, you don't have the advantage on.
If there's no takon in Chutz La'aretz, and then wherever you're living, to refuse the bris, I don't think we have the koyach to say that if a bezdin makes a takon in a certain city, they have the koyach to do so. But the takana that it should be nispashet and kol you're not allowed to give a bris. It's very hard to tell a person, I'm sorry, I can't. It's not our job. That's a doctor's job. We can't do the doctor's job. In Eretz Yisrael, they have more of a koyach to be able to enforce such rules. Befrat, as Rabbi Heber just mentioned, that if you're not going to do it, the same things are going to happen through Michal Shabbos. He's going to do the bris. So what did you gain? It's going to happen Saivi, and it's not going to be done in a kosher way. So you didn't gain anything. So there's no medical concern. You speak with the doctor, everything is healthy. To say that you have to refuse the bris is l'chayra.
Isn't it against the Rambam? The Rambam says suffix kuna don't make the bris.
So the Rambam says the Rambam says that if they don't take the vitamin K, how did you get a bris? How did you had vitamin K?
I had over three.
No, you had vitamin K.
I had 3 bris, and without vitamin K, I couldn't stop the bleeding.
Yeah, vitamin K
Okay,
is
so
serious.
you had in the Chanan? Oh, so
Vitamin K's been around for I think 70 years.
it's 70 years. You can't make such a time. I mean, when the Rambam wrote, there was no.
For 3,000 years, I say, yeah, and a lot of little kids die from bris.
we're not endorsing people not to take vitamin K.
If he doesn't take,
You're saying they had vitamin K. No, I'm asking them this. I mean,
It's a psychosis, there's no question. I would show you bleeding babies that we've seen. It's psychosis of functions.
even with Kalen
No
and
question.
with Thrasher, with nothing. I worked over.
are these if it gets that bad, is there a way to tell before the bris that this baby is more prone to this?
You'd have to do clotting fat, you'd have to do the whole extensive testing, which is not going to happen. I mean, you know, we've been involved with babies that have
Hemophilia.
factor 8 deficiency, factor 11 deficiency, and they have to get fat, you know, but they're managed. We've all seen, we're picking up more babies that the parents get screened and they find out they have factor 11 deficiency. So we know about it, and they see a hematologist, and if they're bleeding, you know, they can get factor, and it's safe. But here, you know,
You have a pashtaitza. They refuse vitamin K. You tell them, I can't do the bris until you get a screening from the doctor. That's it. The doctor clears. There's no chashas, whatever these conditions are. Okay, so that's one thing. But if they don't want to go with it, and if to me, whatever, you have to see. If they're not ready even for the screening, okay, mask him. But with the screening, to refuse it, if Rabbi Non says different.
So I'm sorry, I didn't hear. I was.
The easier answer is oral from the health food shop. They're health food people. They're happy to go with oral again. I've never had a person say I'm not going to do that.
Okay.
A question was asked, there was Mohalim today that feel very comfortable when they do marking before the bris. And they get a better shear and they less freehand, they make a mark. A question to the Rav, marking on Shabbos, is that an issue?
I'll say what I say, and I'll give the microphone to Rabbi Non after. What I was makabel from the Debrecen Dain is you're not allowed to do it. If you're not able to do the bris without the marking, you shouldn't do it. Give it to another male. Why do you have to be the one to do it? It's a chilul Shabbos, shalei l'tzerich. It's not mamish essential to do the bris. If there's somebody who's a bigger mumcha, so refer them to a bigger mumcha. If you need it, then or you can do it before Shabbos if you're able to, depending. If you can, yeah. If you have this option, depending when you come, it's not always feasible. If you're able to do it before, then great. But mamish on Shabbos itself, one should not do so. They should give it to another male.
We hear your opinion about doing a bris to a baby without vitamin K?
Okay, it was said before. So it depends on, like in Eretz Yisrael, they have to ask the Rabbanim there what to do. Each Moel has to ask himself. We can't ask him for them. So it depends on parents. By us, I'm from Montreal, so there, automatically they do it at the hospital, right after birth. Some parents don't. They don't agree, so we don't ask. The truth is we don't ask. We do the bris, even if they didn't do. So it's up to the parents. I know people that didn't give. I didn't see a difference. I didn't see that the baby had more bleeding, whatever. We didn't see it. So again, it depends on the baby, it depends on the case.
Ki Yehuda v'Oed Likra, I'm saying that I've been doing for 20 years, and we have a big community of naturalists and anti-vaxxers, and people, befeiros, don't want it and don't take the vitamin K, and I have never had any difference or any bleedings with
But there is.
I said that from my experience. This is my experience. Chas v'shalom, I'm not. This is my personal experience.
There's another way I've seen people do marking on Shabbos. They'll take the hemostat and give a little pinch on the skin before. Is that making a chapura maybe before?
Or if it's done right by the bris, is it part of the bris?
Or a pinch gives a...
Doesn't bleed? The baby doesn't bleed?
No, it doesn't bleed. No, I'm saying if you pinch with a hemostat, put the inside it means maybe. Maybe it makes a little chabura before. I don't know. Nothing external.
Okay, Okay, so the question is if you could make a little mark without a marker, just by hemostat or something, without bleeding, just a little indentation or something. Is that considered a chabura on Shabbos? Should be okay? That's okay. I'm going to ask Rabbi Banon, if you don't mind, a question. And then there are those who use a clamp in a certain heter manner. Is there such a thing? Rabbi Banon.
Okay, I never saw a clamp that it's a kosher clamp. It's a clamp that's not kosher, or it's not a clamp, something else. So that's the main question. So I don't understand the metzius. What? They don't like it? So what's the toeles? It's like a magen. What's the toeles?
One Moel told me that he files down the teeth part of the clamp a little so that it's not mamish 100% sealed. It's only 99.99, so technically there's down risk.
They keep it open sometimes. So the idea is it holds the skin better. It doesn't fall in. That's the idea.
Okay.
No, if you close it a little bit, but it doesn't really clamp. So that's I've seen some Mohalim doing that.
No, but the question, I know. The question is that okay?
Yeah. No, I know that in the Rabbanut, they have, the magen has to be
1 millimeter.
1 millimeter. Okay? So less than that, you can't do. You can have more. So for the same reason. So if the clamp is less than 1 millimeter, so then it's a problem. It's already like a din of a clamp. So that's the question.
Yeah, I mean, there's it crushes the skin. Whether if it's a very tight clamp, which is a very tight muggin, is almost like a clamp, even if it doesn't have a hinge. So that was the question. Another question, which is negea to Shabbos and generally negea to bris. It's happening quite often now. It's births via surrogacy and IVF. As Mohalim, we encounter this quite often these days. Used to be children that were adopted, and today, I think instead of adopting, they've gone to IVF or surrogacy. So we're encountering this quite often. Question is,
They don't even always tell you.
they don't tell you. And when it comes to Shabbos, is there an issue? When is there an issue, and how to identify the issue?
It's very, very common today. It's very, very common. When I took Shemush and Birna Yados in these dinim, I was told that today's day and age, part of the questionnaire has to be, are you born from, is there any artificial insemination which took place? Was there any IVF? Was there any assistance? And then you have to be chayker. Is it the mother? Whose egg was it? Who was the donor? Who was the carrier? Who was the donor? You have to. Today's day and age, you have to ask. It's no longer the way it was back in the day. That it's under the rug. It's mamish cases which are you don't have to be cheshish to it. Today's day and age, especially, you're going out in Ari Asada, you definitely have to be cheshish to it. And the sad reality is, it's happening in Frum Kehillos also, and they're not saying. They're not telling anything. They're doing it. There are stories, plenty of stories. I don't want to get into details, but there are stories, even in the Frum Kehillos, things are happening. So if somebody's coming to you, and it's a bris on Shabbos, there are many Mohalim that they have a questionnaire, right? Now, to say that you have to make a questionnaire in Crown Heights, in Williamsburg, in Borough Park, in Flatbush, it's taking it... if you're mechuyev to do so, but definitely by Ari Asada, there's a chiyuv to ask. It's part of the questionnaire. Was there any medical intervention, and find out what was it? So if obviously there was egg donation, then the child needs a gerus, and you can't do the bris on Shabbos, for sure not.
So is the shayla if the kid's Jewish or if it's on Shabbos? If the kid's Jewish, it's on Shabbos. It's a very Yadis question, not a moral question.
No.
That's my question. Is it a moral question or it's a rabbi question?
It's the shaila is if it's an egg donation from a nachris. There's a shaila who's this child? Is the child from the nachris? It's his mother or the mother is the birth mother? It's a circus.
It's a yid or not a yid. It's not a Shabbos question.
So it's no, because if the Yom Shmini is Shabbos, how can you do the bris if the child first needs a gedus?
If a kid is not Jewish, you can't do
In a chanami, yeah, it's all part of this. Yeah, in a chanami, you have to do a gedus. It's all part of the. Correct, you can't do the gedus exactly. Yeah, in a chanami. So it's a shaila the child is a yid, and if it's a sergasi, then definitely you have to do a gedus, and if they're not from, we're a little bit stuck. There's not much you can do. Whatever, you have to send them to a bezdin to figure out what their options are. IVF, there's a famous tshuva of the Shemet HaLevi. Rav Osner writes that an IVF baby are allowed to do a bris on Shabbos. There are chalkim, from what I saw, the main psak which is accepted is the psak of Rav Osner on this, that you can do for IVF. It's mother's eggs, mother's a carrier, the father, everything is just the parents. If the child was born on Shabbos, then IVF is no problem on Shabbos, unless Rabbanon says different. Yeah, so IVF is. Yeah, exactly. It's exactly surrogacy and IVF. Yeah. So that's accepted psak.
A much more common question is what happens if most of the people at the bris are going to come on Shabbos? Where is the line that we say, okay, the family, the sandek, or most of the orchim, or everybody's going to come? I had a bris that it was an Israeli couple, and they told me we're going to do the whole Shabbos. We spoke about it and everything. When I got to the house, I was with the shliach next to me. We walked into the house. It was photographers, cameras, lights, music. And then I said, I can't come in. He's like, oh, Rabbi, one second. Give me 5 minutes. 5 minutes later, the house is Shabbosdik, like Reach Gan Eden. So we have a lot of those questions. So when do you...
Okay, there is a tshuva on, Yechavedas has a tshuva on that, Avad Yosef has a tshuva, that minastam, you can't stam bidoiche bris, even if you know that it'll be chilul Shabbos befarasia, זה לא קשור, it's not קשור to the baby, to the mitzvah that you have to do. The only thing is, straight with the baby. That means parents can't bring the baby in a car. Whatever connected to the baby himself, so you make sure. Now people are coming, they're coming. One second. Yeah. Okay. If you can, the sandak. Mohalim kol avonotav, it says. Everybody. So what we do, so when we know that it'll be Chilul Shabbos Befarasia, so we try to find maybe the weight, something. We need a tziruf. Even if that tziruf, if that case, we will do the bris on Shabbos, stam in weekdays, but we try to find a tziruf. Maybe the weight is not we would like to have. Maybe it's a little bit yellow or mushy, so we try to find a tziruf. With no tziruf, it's not so partial to push off the bris, unless you know that the whole thing will be, as you said, they bring the baby in a car, and so then you have no choice to push.
Okay, I'm just going to go a couple more, but I'm going to want from the island, but is there a difference?
A little further.
It's also, one second, Rebbe, it's also important that the parents should know that the reason why you're pushing off, as far as they're concerned, it's not that the rabbi, it's okay to do it on the 9th day. What do they have to understand? They're really supposed to be on Shabbos, except what? Because there's going to be Chilul Shabbos, we're not doing it then because your baby, what then?
Wait.
Baby's not ready.
Yeah, he's not ready. The baby is not ready. Wait 1 day, 1 more day, 2 days.
Play it again. If you're pushing it off, can you do it on Monday or Bessemer? If you're already pushing it off, they're going to say, okay, can we do it? They want more people to come.
They want Sunday, they don't want
They want
Monday.
Sunday. Sunday is the favorite.
No, but regarding kosher, if we have Amin Oras Sada, like the Rav calls it. And we are in like a very, very non-frum community, and a lot of the times they do what we call kosher style, which means that they bring all kosher food.
Looks kosher.
The Iker could be, I'm saying they buy from Costco, they buy non-chalav Yisrael, they try to look, or even sometimes where you know that it might cross the line. I always tell them, and this is the psak that I got from my Rav, that we do it in a separate room. There's no food. There's only kosher food. We put some cookies and this, and then you leave, and then I don't ever walk in there. I don't see what's happening. But the other rabbonim have.
Okay, so the same question is by Sidu Kiddushin, Sidu Chuppah v'Kiddushin. Okay, if you know that the meal they are doing, whatever the event is not a kosher event, so I'm telling you what's the policy in Montreal, the RCC, it's like the RCA here. The rabbis, they have a policy that they don't do officially. They don't do Chuppah v'Kiddushin if the wedding is not a kosher wedding. They don't do. That somebody else do. Or they go to Reform, they go to Conservative, it's their problem. Rabbi Handel of Shalom from Montreal, pasken differently. Say you do Chuppah v'Kiddushin if the couple is a Jewish couple, obviously, and you make sure that she goes to the mikvah. You make sure that's your tnai. You make sure to be mekarev them, and you do the chuppah in another room. Try to do it somewhere else if you could. If it's not possible, do it in another room and leave. Just leave. And do what you have to do. We've seen shluchim that they do that. They bring wine, they bring bread, they bring a shtikla suda, they sit a few minutes, they have a suda, and they leave. So I think by the bris will be the same thing. That try to do the bris in another room, and then you leave. The male has to leave and not to stay there. But what that means, the baby is a baby. It's a mitzvah now that you have to do on the baby. So try to disconnect it from the whole thing. So one thing, I'm sorry, just want to add that we have Mohalim that do that, and I don't. And one time, a Mohel wasn't in town, he had to leave town, whatever, and they told him, so let's call maybe Rabbi Banan. He said, don't call him. Just don't call him, and they called somebody else, whatever, but they did the bris. Kadin v'kahalacha. If not, they might not do the bris, kadin, and take another moil, whatever, that's not kosher.
So I've been in a situation where parents, Jewish parents, not dati at all, adopt a baby, and the baby could be, I don't know, 5 years old or 4 years old, and they want a bris. Well, they're going to raise this baby in a home that's got nothing. So, I mean, I'm not sure what happens in Israel, but there's a question, right, about.
They adopted a Jewish baby?
No.
Yeah, okay, so that's a din that when you adopt a baby, and any case of adoption or giyur that you have to do a bris l'shem giyur, it says in halacha you do a bris l'shem giyur. Yes, the policy is you have to go through a beis din. If they started the process, and the beis din tells you to do the bris, you do the bris. If you just come, somebody had a kind with a shiksa, then he brings.
You need a beis din present.
Oh, that's something else. Yeah, absolutely. But not only that. You could take two more rabbis or whatever. You do a beis din. No, it has to be. There has to be referred by the beis din. They have to open the file and go through the system, to the process. Then Noel does the bris. If not, it's a problem. You can't do the bris.
I once had a situation like that where it was a Reformed rabbi, and I said, I can do the circumcision, but I have nothing to do with the conversion. So they said, oh, we're going to bring our rabbi. So he comes, to the operating room, and he's talking to the anesthesiologist, and he says, "Oh, Hausdorff, you're Jewish. Where do you daven?" He would be like, so we do the bris, and he says right before we do the bris, he says, "Oh, these are my Adim." So the anesthesiologist said, "Oh, I was just in Atlantic City gambling." So, but there's a problem because, and I've been there where there've been conservative rabbis, and I get a call 10 years later saying, "Oh, the conservative rabbi said you did it." I said, "Nah, I did a circumcision. He was there. That's his business." "Oh, but he keeps poor records." I said, "Well."
I just want to add something to this. So when people come to you and they tell you, "Okay, yeah, I'm going through the process. I want to do everything, no problem. Just do the bris," because they want to do it. So I tell them, do whatever you have to do. Go to a doctor. Go to the Beis Din, and then we'll do a tafas dam bris. That's the whole thing.
Okay, I'm going to ask one question, and then I'm going to ask Dr. Stock if he could put up his beautiful interaction that he has prepared from the years before. But us New Yorkers have entered a new era. I just got a phone call. Somebody wants to do a bris on a 2-month-old. And I figured I was going to ask, are you Jewish? No, they're Muslim. So I just want to know.
If you're outside the U.S., I wouldn't touch it. You could end up.
So the question basically is there, I know that Rav mentioned about non-Jewish, is there a difference between Bnei Yishmael or not? Or any other things you want to say?
Okay, so everybody knows the shach, that if you have the shach, you have the taz, the tzedakah, all the shit is if you're allowed to do brisim for goyim. I give it a copy of the sefer. Yeah. Okay, so Bechlal, before we get to Arabs, to Muslims, Bechlal to understand, let's start from the beginning. Right, he has a mechlekes shach and taz if you're allowed to give a bris to a goy. Right, so the shach says the whole inyan is because it's a refuah. You're not allowed to be menapa a goy. So if there's eva, if you're doing it for schar, then it's okay. Which reminds me, there was a story with a very choshev Beis Din. Somebody just started out in Rabbanos, got the shayla from a mile if he's allowed to do brisim for goyim. So he asked this choshev Beis Din if he's allowed to, what should he pass for this mile? To which the response was, make sure he charges. The Rav understood it as a joke. Says, yeah, there's no issur to do a milah for goyim. It just don't let them take advantage of you. Make sure that they charge. He didn't chap. He was telling the shach. The shach says if it's bechinam as a issur and it's dafka if it's being paid for, there's no shaila of refuah. There's an issur to be menapa goy. So you have the famous shit as a shach. The Taz, the Beis Yosef, they write differently. They say no. The bris is a bris kodesh. The Eibishter is going to be made to you. Avraham Avinu is going to be made to you from Gehenna. How can you take away the bris kodesh from? You didn't give it to goyim. You can't do such a thing. The Tzedakah takes a different approach. But Neisef to the others to what the Taz says, the Tzedakah is also Meisef that there's a chash just like by tzitzis. There's an issur to sell tzitzis to a guy. Why? He's going to present himself as a yid, and he may come to chalil and kill a yid. Right? He's going to show, I'm a yid v'chulu. So the same chash is going to apply to a bris as well. This is what the Mil Tzedakah writes. So now there's a whole Pischei Tshuva. There's a big discussion. What about Bnei Keturah, which they have a chiyuv milah? The mitzvah milah was given to them. So first of all, it's machlekes Rishonim, Rambam, Rashi. Who are the Bnei Keturah? Is it only the Bnei Keturah, or it's also all the daters that come from them? Is a chiyuv milah on them as well? So number one, it's machlekes Rishonim bechlal. If all the Bnei Yishmael, if all the Bnei Keturah bechlal have a chiyuv, number one. Number two, the Pischei Tshuva, right? The Shagasari and all the guys over there that Bas and Chayr of Bilbil is called Olam Kulai. So we don't really know today who's who. So the whole deal, if do you say Balta B'Reiv, it applies to Goyim, it's only din by Yidin, v'chul is the whole Shak of Ataria. So a lib demis, when you go to the whole sugya, there's not too much to be samech on. It's a sniff, it's a limud schus to be mal Arabs, that it's maybe you have episode what to be samech on, that it's easier to be mal in Arab than another guy. So what? Okay, serious, it's serious. My goyim, not so simple. So there's a few answers. So number one, before we get to Bnei Yishmael themselves, the question is, why are you doing it? You know, some may have a taina, they're ba'ari asada, they need to keep the umnus up. Okay, you have nothing to do, you have no other choice. In order to be, when it comes to a yid, you're going to be able to have to keep your umnus up. Okay, everyone should ask the Rav if they should be samech on the shach. You have a shach to be samech on. The shaila is if this is the right thing to do. There's a bigger question. What are you doing? They're doing it for a medical procedure. You're not a doctor. You're not a medical professional. Let them go to the hospital. Why is it the male's job? In England, for religious reasons, so let them go to their religious reason. Why is it you? Why does it have to be you? So in Europe, they have... Exactly, yeah. So in Europe, you have in England, you have the Igad Mohalim. Listen, so you can't, not going to be meicha, those who are samech on the shach. If you have the shach to be samech on, so fine. That everybody has to ask their meirera in their case, if you could be samech on the shach. But then there's a Madam Shik. The Madam Shik writes, you can do mila without priya. The whole Isser doesn't apply if you're doing mila without priya. The whole shak of the whole discussion is not going to start then. So another eitzah, but again, what are you doing? Who's taking liability? Something goes wrong. You're not a licensed doctor. What? Yeah, but if something happens, you're not a doctor. What are you going to do? For a yid, you have a mitzvah. There's a chiv to do so. There's a mitzvah to do so. But if you're not a doctor, you're taking a big chance. You're taking a big chance, and yeah. Yeah, that's right. That's right. Banan, if there's any.
Okay. I just want to add something. I had, we did have a uvda. It's a long time ago, maybe more than 40 years ago, 43, 44 years ago. I'm from Morocco originally. I was appointed a Dayan, young Dayan on the Beis Din there. And there the Beis Din is official. It's part of the court. It's official. So the Dayan is like a judge. You get your salary by them, by the court, and the head of the court called me. He had a boy himself, the president of the court, a guy, and he wanted me to do the bris as a tova, So it was very hard for me, So I asked the Av Beis Din there, who used to be also a big mohel, big mumche, and he told me, you do it betzina. Do it somewhere betzina, not befarasia. And bit somech on the shach, and mishum darke shalom. It was one-time thing, mishum darke shalom, v'zeu, and that's it. So that was one-time thing. That the first and last time I did for a goy, but it was very special. So we were somech on the shach then. I'm not saying that have to do. I have a friend. He's a urologist in Geneva. Maybe somebody, Dr. Bitton, his name. Yeah, you know him. Chaim Bitton, yeah. He learned Mila by me. So, and he does for goyim. He does as a rofe, but he's very, very, very careful by giur, by everything. He's very careful. By goyim he does because it's his thing. He's as a doctor he does it. But when it comes to Yidden, he's very careful not to do giurim if it's not accepted, whatever. So but he does as a doctor.
Can I share, ask a question just
Wait.
So this sort of touches on this question of like, what are you doing? I think like a lot of Mohalim are very upset when like doctors there's more like reformed doctors that are going Mohalim and that are acting like they're Mohalim, and then and that a lot of non-frum families want to go with such people, but there's also like even like some of the questions, like I feel like if you're gonna walk around and say that, oh, like I'm better, I'm a big mumcha, you should really know a lot about medicine. I feel like a lot of Mohalim are very confident, but they really don't know a lot about what's going on. And I feel like it's important for Mohalim to know their limitations, which I appreciate why Dr. Stock is so helpful to sort of create like a gvul of like, what we do this, we do Milo, we do, but I'm wondering also, because when the people, in terms of like if we're trying to be, when it comes to doing goyim, when it comes to doing all these sorts of things, and or like, and again also about the vitamin K question, if a doctor did by vitamin K, they'll say, oh, it was like a hospital, it was a mistake. Anything that a mohel does that's bad, it ruins it for everyone. So also like in general, like goyim, you mess it up, it's gonna mess up everything. And same thing too, like, it's like I personally, like the psak that I got was that I should not do without a vitamin K shot, because it's very important. But also if we all set the standard together that this is the correct thing to do, then it's a united front. But then always there's going to be like the newer guy that's going to want to get the bris, and then he could screw it up, and then it could ruin for everyone. So I'm just like thinking about Maleches HaKodesh Bichlal can be saved if we have like a standard of what we're willing to do, and it's not just about the yachid to get the bris. I don't know. I wonder if there's like a psak or a halacha that takes that into account, not like the individual baby, but the larger mitzvah staying among the majority of Klal Yisrael, and like if that's consideration that can be taken in terms of like our nihul as professionals.
But besides the halachic issue, it's become dangerous. Absolutely. And we know people ended up in jail, and there are people who traveled around the world to do brisson, and to do it for a non-Jew and end up in jail. You don't know what's going to happen. I mean, it's not like it's not so simple.
I just want to mention that with the help of Dr. Stock and others, there is a medical textbook for Mohalim being produced, which will give Mohalim the language, the knowledge, the means of communication with doctors, together with parents, bringing up their information knowledge. Like you're saying, it's important for them to know. In addition to know the limitations, it's also it's important for them to know how to be able to communicate and how to be able to present why they're doing a certain thing and why not. Yeah. Present. Do you have your laptop you want to put on?
No, I think it's
Okay. More information on the book? Yeah, when it comes, it's a medical textbook. It's with graphic pictures, so it's not for everyone who's not part of the team. It's going to have a lot of different structural of the anatomy, medical conditions, and anomalies, and a lot of that discussed but clearly defined. So Mohalim should be able to look at a textbook. It's important. I haven't seen anything out there yet, so it's coming.
Ask a shaila for the Rabbanim. I think it's more negay and Arei Asodeh, where sometimes we get a call they don't ask for Hatafas Dam, but they're asking for a naming. Well, oh, had a baby in the hospital, didn't realize, and now we want to do it properly. And I realized that it's very tricky, because on the one hand, the kid, it's a Yiddish kind, and was is there schuldig that 2 days he had a circumcision in the hospital. But if you're gonna go and do the Hatafas Dam, it's kind of giving a stempel that in the future we could do the circumcision in the hospital, and the rabbi is going to make it good. Can you turn down the Hatafas Dam because it's bringing chalishis to Mila?
You can be samech in the shagas area. That's not going to help you anything. The Hatafas Dam is not going to do anything. Once you take it out. No, I'm not saying this lamais. I'm saying there's a shit. Yeah, sure. The shaykhant has. Sure, if you did it within this man.
I do it with people I'm close to, but people like Stamazay,
Rama writes, the Rama writes that if you're Maltaich Shveder, there's a chiluk between Yom and Laila. If you did it by Laila, you're mechuyev to do Atavas Dam Bris. By Yom, you're not mechuyev. So Shaykh and Taz argue on the Rama. He says, no, you're mechuyev. The Shaila is a B'teres Chumra, is a Mamish Chiyuv. This is a chiluk. This is a chiluk in the Rishonim. If it's a chiyuv, it's Mamish Chiyuv, it's a Chumra. The Shagas Aryeh writes, it's not going to help you anything. Once you took off the Arla without a bris, without in the proper way, Teich Shmeina or B'layin, you're not doing anything. There's no tikkun. You have Evna Eizer. The Pischei Tshuva brings Evna Eizer as a limud schos. You're not going to tell them that, but in the back of the Rav's mind, you have the Evna Eizer to be semechan that in Arla Yisrael, the bris is still going to be kosher. But Rabbanan, what the Rav say?
In Sydney, it was decided not to do Atafas Dam. We have a situation by us with a non-Shema Shabbos pediatric surgeon that's now always become very popular. And the Bezdin decided, which is Rabbi Ullman, and I'm sure many of you discuss your shilas with Rabbi Ullman, and I'm lucky enough to be in his Daled Amos and speak to him daily and work with him very closely. But it was decided not to do hatafa. Anybody who goes to him, we are not going to correct it afterwards because you're making it okay.
One of the Rabbanim in Florida suggested that they should do it. You should tell them that the kid should come at 5 years old. So he still has a hatafas dam, but he's not. You're not going to leave him oral, but you're still not making it kosher, giving it a stamp because it's only happening le'achar zman oral.
Every kahila, you have to be done. Every kahila for itself to be migdal milsa. In Sydney, there's mamish periods. There's one person. Everyone's going. There's a chiyuv, the migdal milsa. You can't. You have to stop it. You have to put a stop to it. There has to be a consequence. There has to be the migdal milsa. We cannot allow this in a place where it's not a pirza. Maybe bari asada. Somebody pasha doesn't know, and you'll explain to them. We're not being machshir what you did. You know, you're a yid. We want to do our tavas dam bris, but this is not the right way. Don't go and tell your friends v'cholo. Maybe B'ari Asada, when there's not a pirza like this, it could be different. So you have to be done. True. The shaila is, but it's not going to stop the problem. If people are going to, if you have a doctor that everyone's going to, it's not really going to help. So they'll know in 5 years from now they'll get a fix. The Orthodox rabbi is also going to be happy.
Shaila is if you Shem Shabbos.
He's not Shem Shabbos. He's not going
He does in the hospital for 8 days.
Does in the hospital. Does it and the shul.
He's a mum. He's not Shem Shabbos.
Can we apply that?
I have this argument with people, especially bring him into your shul. She's saying she's not Shem Shabbos.
The question I was asking the first time I got a call was from another shliach that the baby was born during COVID, during lockdown. So the parents were very scared and they didn't want to, So it was inus. So I did the hatavas dam, and I explained to them that in the hospital they had a circumcision.
Because when COVID was going on, they weren't doing them, and I ended up doing all these babies.
No, but they had medical circumcision done in the hospital. So I did the hatavas dam. And then 18 months later, they had another boy, and then they called me, "Could you come to the hatafas dam?" So then I realized, okay, it's good. We're going to do it our way in the hospital, and
Okay, this is. I just want to mention one more time that we're here from all over. We're here to accept the service, the willingness of the doctors and the rabbanim and the urologists that are here to assist us in every which way, and we're grateful and appreciate. And I highly recommend, after the get-together official discussion, to come over, introduce yourselves, take a phone number. You probably will need to know the urologist. As Dr. Stock always says, it's important to have a good urologist on your side. If you're living elsewhere, a local urologist, a local pediatrician, to be able to communicate in order to send people to and to have a common understanding. But this is one question before we conclude more or less to the anesthesiologist, because people are very afraid of pain. They want to know if they could put on EMLA. They want to know if they could put on a topical anesthetic. And there are different percentage of lidocaine, anywhere from 1% to 10%. If there is something to be concerned about, and what is the difference between 1% and 10%? Doctor.
Well, it's a weighted question. If you could put on EMLA or give anesthetic, you'd have to ask the Rav. If you're talking about before the bris. Because before I became a doctor, I was a rabbi. Like I tell everybody, rabbi comes before doctor. I'm not a practicing Rav, but the idea is I grew up in a frum home, in a Chassidish home, and I recall, and I don't want to overspeak the rabbi, but a bris is supposed to be, the baby's supposed to feel it. And if you're talking about an Arya Soda, not frum, I think that could be a different conversation. I don't know. But unzer, like the rabbi said, like the Rav, Rabbi Kasimov said before in the beginning, you look them in the eye and you say the Torah says this is the bris, and forget about it. That's how I personally look at it, without it, and not as a Rav point. But I think this is a question for Rav. Are you even allowed to put an anesthetic before the bris? And we're talking about a baby 8 days old. I'm not talking about older, whether older children or adults. So let's get that one out of the way first.
Halachically, I don't see if parents want. Stand talking halachically, okay? After we see the, okay. I don't see a problem if they want to use EMLA, if they want to use it. I do by doctors, and they tell me not from Dafka, not from doctors. They call me to do the bris, and they all tell me, Rabbi, do what you have to do. They are not asking for EMLA. They're asking for nothing. And they know. The doctor told me, the doctors will explain more than me, that when you use EMLA, so it swallows the place, there's more bleeding. And not only that, it's very hard for the bris. It's greasy, it's very hard, it's not easy. So, but again, if parents, bedafka want, if it's from parents, so I tell them, call somebody else, I'm not doing. If it's not from people, and I might go to somebody else, so then yes, it's fine. If they want to use it, let them use it. But at least they have a kosher bris. So again, as you said, it depends. You look to the parents and you tell them. If they're from people, so they have to do kadin v'kadat, and no. So, but halachically, I don't see a problem if they want to use it.
Is there any source that the baby should feel pain, like you said, that the baby should be?
The doctor will say. The doctor said that at 8 days old they don't feel. They don't feel the pain. That you I don't know what you say. That what I heard.
I don't remember.
I don't. Okay.
So now the other question. Now that we got that out of the way. I'm happy. Because like I said, it's not me to say. The Rav said they could do it. But again, like the Rav Rabbanan said, if you tell the parents, okay, you want to do EMLA, not a problem. However, just realize it actually may make the bris more difficult and therefore cause more trauma to the baby and so on and so forth. That usually changes their minds. Because they really don't know what they're doing, and they don't know what they're saying. And again, they're intelligent and they're educated. They go on to Rabbi Google, Dr. Google, and Mr. Google, and all those. But at the end of the day, they really don't understand. To use, again, Emla is safe in babies. There are other things that are safe in babies, but just recognize all these things are medications. And to feed off a little bit of what the Mohalim was saying earlier, there is a disparity between doctors and Mohalim. We should have extreme respect for each other. And like you said, humility goes a long way. Even amongst doctors, I hope, it says Tev Shebereifim Legehenim. It doesn't say good doctors, it says Tev Shebereifim. What's a Tev Shebereifim? The most common explanation is the doctor thinks that he's it. Every doctor has to have humility, that they ask questions, that they say I don't know or I can't, or refer to somebody else, and so on and so forth. I think the Mohalim also have to have humility too. You may all use, it's only, what is it? It's local anesthetic. It's still a medication. Officially, you're not a physician. You're not a nurse. Even a nurse can't use it in most places without the direction of a physician. You're not a PA, so yeah, go ahead. We're not going to go into that, but just recognize it is a medication. And if you're going to use a medication, you're going to have to understand what the medication does, how it works, and what does it mean. What does 1% lidocaine mean? Does everyone know what 1% lidocaine means? And okay, I have one hand. And don't be shy. I mean, if you know, you know. I'm not going to call you out on it, but if you don't know, just recognize that you don't know, and you're using a medication. So now, what about 4% lidocaine? What does 4% lidocaine mean? What about 10% lidocaine? I heard that. I personally have never seen 10% lidocaine. I understand it's made in bootleg stuff in other countries, maybe, but what is 5%? Yes. Okay, so
Xylocaine.
xylocaine is lidocaine.
You know what I'm saying? But the company Xylocaine puts a topical mucosal for 10%
For
for dentists.
dentists, okay. So, but I personally, I'm not a dentist, so I've never seen it. But that's fine. So, what does it mean? The percentage is it's a concentration of the drug. So now, first of all, you have to understand there's other. Are you guys all mostly using lidocaine? If you use anything, Emla is a separate. We're not going to talk that because it's not only lidocaine. But are you guys pretty much only using lidocaine? Pretty much, right? If you what else is in it? Okay, but the anesthetic in it is just lidocaine. But it's just lidocaine. I'm asking. There's a reason why I'm asking. Okay, so pretty much you guys are all using lidocaine. So you have to understand, there's potency and then there's concentration. Higher concentration doesn't make it more potent. Potency is in the intrinsic pharmacological aspect of the medication, and it's the molecule that the medication is. And there's different potencies amongst medications. That's what you'll find. Other anesthetics, local anesthetics, they'll be less, 0.5%. What does all this mean? So first of all, percentage is a concentration. Just know 1%, it will start from 1%. It's 10 milligrams per ml. Okay, why is that important? It's important. So 5% is how much? 50 milligrams per ml. 10% is 100 milligrams per ml. Why does that matter? If you're administering a drug to anyone, just know what that drug can or can't do to that patient. Lidocaine can kill. Straight up. It can kill. I give it all the time, and it doesn't kill because it goes by concentration. And so we have it, it's a dose. It's called milligrams per kilogram. Does anyone know what the milligram per kilogram max dose for lidocaine is? Not a hand. And you're all using lidocaine. Where's the humility? I'm not telling you not to use it. But it's not just a benign thing. Babies.
Using epinephrine.
Right, so, well, epi. If you use epi, then you should stop being a mile. Epi does not belong anywhere near the penis. Doesn't belong there. Any doctor who uses epi there, that's Dr. Stock, he'll be the first one on the witness stand to testify against that doctor.
So the thicker necrosis that happens.
That it's
The
not
problem is when you're bleeding, so you put more epi on it.
correct.
So, and that's where you get into trouble.
Yeah. So again, you have to know the medications that you're using. Not one of you knows even what the maximum dose of lidocaine is. Baby, how much does a little baby weigh? Newborn baby, the average 6 pounds, 6, 7 pounds. How many kilograms is 6, 7 pounds? 3 kilo. The maximum dose for lidocaine is 4.5 milligrams per kilogram. How much are you administering? Now, if it's on intact skin, it still gets absorbed. Otherwise, how does it work? So how much you putting on? That's why there's a rule how much Emily you could put on, right? But now if it's not intact skin, I had one of the Mohalim ask, what about putting it on after the bris? You have an open wound. It absorbs much faster. And if the parents are going to be putting it on a couple of times a day or every diaper change and whatnot, because they're worried about the baby's thing, so that builds up slowly. So you may give a fatal dose even to a baby, just absorbed that way. So again, like I said, humility is a very important thing. So know your medications. Let's say take adult. If I don't know how many of you do adults, you do lidocaine injections, right? If you use 10% lidocaine, I don't know if it even comes in liquid form, but even if you use 5% lidocaine, how many cc's, how many ml do you use for the injection? 5, 3, 2, 3, 5. It depends. How many you're doing around? You're doing like doing 3 sites. You're doing a ring block, right? Most of you are doing ring blocks, correct? Whoever does adults, you're doing a ring block. So you're doing for the ring block, you're doing what? 5, 6 cc's. If you use 5% lidocaine, that's how much? You're talking about 300 milligrams, right? Now, the chance of you doing an intravascular injection with that 300 milligrams is low, but you still can be giving that. That's a lot of lidocaine, and do you even need it? You don't need it. For an injection, for sure not. 1% is perfect. 0.5% even works. It just won't last as long. It may not take effect as fast. So 1% is a perfect medic. Do you use more than 1%? Maybe 2% when you do?
Usually use, no, 1% lidocaine.
You do 1% lidocaine.
Not a lot.
Yeah. And then you
some sugar water.
Then sugar. That's it. 1% is enough. If for injection purposes, there's no reason why you should have even more than that in your arsenal. There really is no reason. So if you understand the medication, the higher percentage doesn't make it a better block. It doesn't make it a better medication. So why do we? So I'll just say, why would we use a high percentage? There are different reasons. Speed of onset. 1% for the penile block works wonders. You inject. I see it all the time in the OR. Inject and start cutting almost right away. It works. 4%, 5%. It's just not necessary. The only time that you need a higher concentration is when you're doing topical, because you want that it has to absorb through the skin, so you want more of the molecule to absorb through faster. That's why all these topical ones, they're all, the creams and the ointments, they're a higher percent. But you have to just also recognize that it's still getting absorbed, and babies, their metabolisms are different. There are some local anesthetics that are topical anesthetics that should not be used in neonates. I think tetracaine, they'll say, but there's certain ones that you should not be used. Now also, there's some genetic, there's a number of families that have certain genetic dispositions like G6PD deficiency, and you give them certain local anesthetics, and they're going to have methemoglobinemia. How do you treat that? You don't have that in your bag to treat it. Right? So you really, if you're going to use a medication, by all means, know it and study it. And I hope Levi has this in his textbook coming up. He should have a chapter on anesthetics, and if he doesn't, I think they should hold off on publishing the book. This is all I can say. Now, again, using it, that's the rabbi's choice, but I think most parents, if you tell them that it'll be easier, faster, safer, and so on and so forth. There's some discussion in the literature. It's not hardcore that it affects wound healing. So to put it on after the bris, because there is some local effect that the nerve, when the nerve fires, it helps with. You need some inflammation in order for the wound to heal. And if you're going to deaden that, there may be some. It's a discussion in the literature. I can't tell you if that's really something significant or not. Dr. Stock maybe could tell you that. But just know that whatever you're doing is not benign. It sounds, it's everyone localized. It's not benign. There's nothing that you're using that is benign. And as long as you understand that and use it safely, then it's perfectly fine from that aspect. I personally don't. I really don't think that anything above 5% is necessary. Or I think you shouldn't. Now talk about topical. Yeah, I mean, like in the ointments they sell, they're paying like the first aid ointments with stuff. Yeah. So but how much are you putting?
You can't put on compound.
You can't keep putting it on because, especially if you're not cleaning off the old one and how often you're doing it, it builds up. So I think all of us turned out all right without the local anesthetic.
Right. I do want to mention that
Mandy still has trauma, but I think that might be
I
from
want to mention
our interaction earlier on as Bochum.
But I promised that we would be over at 11. I know for Mohalim, we don't try to cut it short, but this is what we have to do. Short to the point. I'm going to ask all of you the opportunity to talk to the Rabbanim, get their information, talk to the doctors. Really appreciate everyone who came. Really appreciate the panel, the doctors, the urologists, the anesthesiologists, and the Rabbanim. Tova Aleichem Bracha, Yeshkoyach Gadol. Anybody wants to Shira Miles as taking the bris papers, you can take one. Whoever wants Meyer.
Even a Jew has to pay for bris because mobile fire, usually. The other thing is, the story about the guy with the face. The guy who says the best one. What do you want to pay? Very nice. It's good. So I came late. I had a session.